Hi everyone, I welcome you all to my channel, and today we are going to discuss a very important topic, that is the branches of the arch of aorta, from where a lot of questions are being asked every year. In whichever exam you are opting from, you can always expect a question from the branch of different arteries, and branches of arch of aorta is especially important in that part. So without wasting time, let us just begin with it. So basically, just consider this as a hypothetical diagram. Suppose if this is your heart and this is the left ventricle, this is the left ventricle. The arch of aorta arises from the left ventricle, and this part, which is just carrying the blood in the upward direction from the left ventricle, this is known as ascending aorta. This is known as ascending aorta. And this part from where three branches are again coming out, this is known as the arch of aorta. So all the three branches that we are going to see arising from aorta is actually arising from which part of aorta? This can be a question once again, but it's an easy one. This is arch of aorta. So again, this part of aorta which is descending downward, this is the descending thoracic aorta. Descending thoracic aorta, and this is going to continue downward. This is going to pierce the diaphragm and then is going to continue as the abdominal aorta. So this first branch which is arising from arch of aorta, this is known as brachiocephalic trunk. This is known as brachiocephalic trunk. This part 2, this is known as left common carotid artery. Left common carotid artery, I'm just writing it in short. And this number 3, which is labeled as number 3, this is the left subclavian artery. This is the left subclavian artery. So the first branch that is arising from the arch of aorta is the brachiocephalic trunk. The second branch which is arising from the arch of aorta is the left common carotid artery, and the third branch which is arising from the arch of aorta is the left subclavian artery. Now a most important part of this point of this whole video is that the branches of the brachiocephalic trunk, this again further gives two branches. This one is known as the right common carotid artery. So this is the right common carotid artery, and one more branch which is going in this direction. This is the right subclavian artery. This is the right subclavian artery. So these are two branches which is arising out from the brachiocephalic trunk. I know the diagram has become little bit clumsy, but so are the branches of the artery. So you have to see, right subclavian artery is a branch of brachiocephalic trunk, and right sub common carotid artery, that is also a branch of brachiocephalic trunk. Now the questions will be arising from this part only. Like the first question that may be asked to you is that question number 1, that is left subclavian artery is a branch of dash. This may be asked in case of VIVA also for the first professional year students, and this may be asked in case of your MCQs also. Left subclavian artery is a branch of dash. The answer will be arch of aorta. As you can see from the arch of aorta, left subclavian artery is arising. Now the examiner will twist the question and ask you, right common carotid artery is a branch of dash. Right common carotid artery will be the branch of brachiocephalic trunk, not arch of aorta. the in your options arch of aorta will also be there, and you will have temptations to mark arch of aorta, but please remember left common carotid artery, that is a branch of arch of aorta, that is a branch of arch of aorta, whereas right common carotid artery, you can see here, this is a branch of brachiocephalic trunk, brachiocephalic trunk, which is in fact the branch of arch of aorta, but this will be your answer in case of right common carotid artery. Same is for the left subclavian artery also. The third question will be asked is that left subclavian artery is a branch of dash artery. Answer will be arch of aorta. Now the question will be right subclavian artery is a branch of dash. My answer will change and it will become brachiocephalic trunk. Right subclavian artery is arising from the brachiocephalic trunk. So these are the 4 probable questions that can be molded and twisted in many ways and can be asked. So this is a probability that these questions will be asked regarding the branches of aorta. And the second most important thing is that you have to remember the level, that which structure is piercing the diaphragm at which level, that is also important. Like if this is a diaphragm, this is suppose the arch of aorta or the descending thoracic aorta.